You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, testosterone replacement for women, pellet therapy in particular. Is it effective? Does it work? Is it safe? With us, we have an expert on the topic, Dr. Howard Liebowitz. Dr. Liebowitz?
Hi, Randy. Good to see you.
Now, first off, we should say, you're a fan of testosterone replacement for women. You believe it works, it's safe, it's effective, all of those things. And I have a lot of questions for you. But we go way back. I mean, I met you a long time ago. But for people that don't know you, give us a little bit of your past at Cedars-Sinai, kind of.
I started out in the emergency room. I was an ER doctor, trauma, at Level 1 Trauma Center for almost 20 years at Cedars. And then I just evolved into functional medicine over about 10 years ago.
Okay.
And part of functional medicine is trying to get the body to heal itself, to function normally without pharmaceutical intervention. And it's almost impossible to do that without replacing people's hormones as we get older, because that's one of the biggest deficiencies that the body goes through is the loss of our hormones. So replacing hormones became an integral part of a type of preventive medicine or functional medicine, replacing the body's normal function.
Now, you were in the ER at Cedars for a long time. You also ran the Pritikin Center. Is that right?
Run the Pritikin
Or
Center,
you worked
but
with?
I worked there for years, yeah.
Okay.
I ran the Ironman.
Oh, is that right? Okay. Now, you don't agree in that philosophy anymore? The
Well,
Pritikin diet?
If Nathan Pritikin were alive today, he'd be whistling a different tune. His diet, as you probably remember, was high carb, low protein, and low fat. And we all know that the high carb diets are actually harmful.
Okay.
They're very glycemic, and they cause a lot of problems. He was getting good results in those days because the people he was seeing were so bad off, and they were eating such bad food that almost anything you did for them was an improvement. And he did get people to exercise a lot. He had
It's kind of like the China study crowd, where a lot of these people were eating so bad, you put them on juice and you put them on, you know, a vegan diet, and they feel better.
China study is a little different than Pritikin.
No, but I mean in the same way, that because some people get great results from the China study.
Yeah. You take people off of high sugar diets in general, and you do any modification, just get the sugar out of their diet, and they will do better. And Pritikin was anti-refined sugars. He was high carb, but they were complex carbs, so lots and lots of vegetables, but he did allow bread, and he did allow rice and pasta and things like that. And right now, the push is more paleo and away from the starchy carbs.
Okay, good. Now with you, you have a big center in Los Angeles. Is it Santa Monica?
Santa Monica, yeah.
And you deal with some very famous people, but regular people. You've been specializing in women's hormones and men's hormones for quite some time, about the last 10 years.
Yeah.
Okay, pellet therapy. And specifically, we're going to narrow this in this segment to testosterone replacement for women. Tell us. So is it effective? Is it safe?
The testosterone pellets for women are very interesting because I have a lot of patients, women per se, who will come to me and they're having terrible menopausal symptoms and they don't want to take estrogen. They're afraid of estrogen, or they have a strong family history of breast cancer, or they've even had breast cancer themselves. And they're miserable. They have hot flashes, night sweats, they can't sleep, they're gaining weight, they have no libido, their brains don't work, they're getting osteoporosis. All these problems are developing, the typical problems of menopause. And most doctors, when you see a woman like that, they have no options for them. Well, there's an option for them. They could actually use testosterone alone, and it can lower their risk of breast cancer. Testosterone has actually been used to help treat some breast cancers because it downregulates the breast estrogen receptors that are so responsive to breast cancer. And then people say, well, what about all the side effects of testosterone? Can it raise their cholesterol? Can't it make them lose hair? And
make them grow hair?
It actually grows hair.
Okay.
It does the opposite. There are so many misconceptions about some of these hormones, and testosterone for women is one of those. And I've been doing this with a number of my female patients who do not want estrogen. They're very estrogen opposed.
Because of the breast cancer?
Mostly because of the breast cancer concerns.
Yes. Okay.
And they have an option, and they do very, very well. Now, I can't say it's 100% because nobody is the same.
Give me samples of people this has worked for that come to you.
Well, one of the things that happens with testosterone that's very interesting in women, and you probably know about this because it happens in men and is unwanted in men, it gets aromatized. And when testosterone gets aromatized, what that means is it's getting converted into estrogen. But it doesn't happen in huge amounts. It's not the same levels that we see when we give women estrogen, when we have them rub estrogen cream on. But it seems to be enough estrogen to cut off all of these menopausal symptoms. And at the same time, they have a nice level of testosterone, which gives them all the other benefits of the hormone. So they get very good libido, they can work out, they can put on some muscle, they can get lean, they can lose weight, and it doesn't have an adverse effect on their hair.
It's good for the brain, testosterone?
Excuse me?
I mean, it's good for the brain?
Fantastic for the brain.
I mean, are there studies on
it's a
these?
neurotransmitter.
On what we're talking about?
There are papers and papers written about testosterone only in women, and I've been seeing this in my patients, and a lot of my women patients who are doing this are very happy with it, and they're very happy that they don't take estrogen.
But one of the reasons, and we have a couple of minutes left, pellet therapy though. The delivery system, because most women, I guess, when they get testosterone, it's a cream.
Right.
And you like pellet therapy.
Yeah.
And but the argument, and I want you to answer this, is that they'll say that the problem, other medical doctors tell me, the problem with pellet therapy is you can't control it. You can't titrate it. You don't know how it's going to work. Well, makes sense. I mean, it's under their skin.
Yeah, but generally, I don't just go to pellets right off the bat. Usually, my patients have some experience with hormones. And sometimes I actually will have my women patients use more testosterone as a cream for a few months. And we kind of test the waters a little bit, and we see how they're going to respond to testosterone.
Like how they feel.
How they respond, what happens to their skin, what happens to their hair, all of that. And then if they have a good response and they like the way they feel on high-dose testosterone, it's messy, you know, to put creams on multiple times a day. It's not very sexy either. So we can put a little pellet. The pellets are about the size of a grain of rice. They're tiny little things. And I usually put them behind the hip on the low back. So you don't even see them, you don't feel them, you don't know they're there, and they slowly dissolve and release small amounts of testosterone. And if you've done your homework with the patient and you've been doing the testing with the creams, you can come up with a dose pretty closely.
How often do you retest?
Well,
with your pellet patients?
After I put the pellets in, I like to get a blood at about 8 to 10 weeks. That's like mid-cycle for the whole length of the pellet. The pellet lives for about 4 months under the skin, and then it completely dissolves and disappears. And then you have to get a new one put in.
Does it hurt?
Well, no. I mean, it's a little Novocaine in the skin, and you do a little nick, like a little puncture hole with a scalpel, and then a little thin, you know, the cocktail drinking straws, the real little ones, that you kind of slide something like that under the skin, and then you just push the pellet down and pull out the straw, and you close the skin with a steri-strip, and you're good to go. You're out the door in 10, 15 minutes, and then you have hormones for the next 4 months.
How long have you been doing pellets? Because I know in the old days you weren't into pellets.
Right. I've been only doing them about a year. But they're getting more and more popular.
Are you getting better results with the pellets than you were with creams?
Fantastic results with the pellets. Patients feel so good. And I did them for myself, and I couldn't believe how good. And I've been on testosterone now for probably almost 10 years. And I did the pellets. I went from the shots to the pellets of testosterone just for myself. And it was almost like euphoric how great I felt. Really,
Is that right?
It was amazing. It was amazing.
So you do the pellets?
Yeah. They're fantastic for men as well. And it's so convenient. You know, one of the reasons I got into this, I have a lot of male patients who would come to me. They're businessmen, they travel, they're on airplanes all the time, and they don't want to carry needles and syringes. And these women too. There are a lot of business women who are traveling. They don't want to carry the creams. They're having a hassle going through the security checks. And they came to me and they said, isn't there an easier way? There's got to be something that I can do without all this messy stuff. And I started researching and found out, let's try doing these pellets. And the more I started reading about it, the more I was impressed at how good the results were, and then I started introducing it with my patients, and I started to see exactly those results. And people are very happy with them. It's so convenient, you know, with women, and women don't have to just take testosterone. Sometimes I put a small estrogen pellet and a testosterone pellet. And those women, all they have to do, 2 weeks each month, they take progesterone.
Interesting.
And 2 weeks of the month, they do nothing. They just get their hormones from their pellets.
Interesting. So what do you look, and we're out of time. If you're looking for a doctor that does this, how do you find one that's doing pellets? Just Google it?
A lot of, it would be an anti-aging doctor, obviously, or somebody who is specializing in hormone replacement for men and women. But a lot of those doctors, you'd be surprised that pellets are pretty uncommon. A lot of doctors don't like them.
I know.
They don't trust them, and it's just because, it's like anything else in medicine. The more experience
But you didn't
have
trust
with
them
it,
either. I think I talked to you about 3 years ago.
Yeah, but the more experience you have with something, the more comfortable you are with it.
And there's studies out?
There's great studies out on it now.
Let's show this. Okay, good. Well, Dr. Liebowitz, always a pleasure to have you on the show, and we'll have you back to talk about some of the other topics.
Okay, great. Thanks,
hormone
Randy.
issues.
Yeah.
You're watching the Wellness Hour live. I'm Randy Alvarez. We'll be right back.